So this patient has an interesting history. So she's a cancer survivor, had a complication with COVID, had pneumonia and a PE. She was on blood thinners. We got medical clearance, and today we're doing a 360 fat transfer with Renuvion. I think the take home is that a lot of people ask, oh, I had this, I have that, can I do surgery? The answer is yes, you can. You're going to end up getting cleared, but we may have to take some precautions. Like for this patient, she's going to be on a blood thinner post-op. Additionally, both the patient and the surgeon have to be on the same page in terms of both risk and benefits, and the patients have to understand that they're higher risk, and they have to be okay with that. Patient is in her 50s. We're going to bring in the waist as much as possible. Now her waist is very narrow. What does that mean? Her waist is narrow because her rib cage comes pretty low and her iliac crest comes up high, so she has a very narrow waist. The waist is really the space between rib and hip bone or crest. So if you're at home, feel your bone, feel your rib, feel your crest, and you can feel your waist. So she has a narrow waistline, and we're going to do our 360, add a little bit of fat just on top, and do the arms as well. We're doing our 360 fat transfer. We're lipoing everything up from the upper back to the waist. We're going to take down the saddlebag a little bit and expand the buttock as much as we can. She wanted a little bit in the hip dip, not too much, but nothing in the thigh. Alright, we did our 360 fat transfer. Brought her down as thin as I could, about a centimeter pinch. We did Renuvion Skin Tightening, soft tissue contraction to the back, as well as expansion of the buttock. Really thin pinch, that's as thin as I can go. Remember, the waist is not just about lipo, it's about the width of the muscle and the width of the rib cage. She had a pretty wide rib cage relative to her pelvic bone, so this is as small as I can get it. I added some fat here, and overall she's going to have a great result. Alright, so a couple pearls from this is that she's a cancer survivor, she had previous PE. It's a long conversation whether it's worth doing the surgery or not. It's case by case, it's too deep and technical to do it on this quick YouTube, but the point is it can be done in some cases. Additionally, she had anatomy that was not favorable for an hourglass, wide rib cage, narrow pelvis, so there's only so much you can do with surgery. And today what we did was lipo as much as we could, and created as small waist as could be created with lipo alone. But if the patient wanted further enhancement of the waist, we'd have to either do a revision tummy tuck. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.